At 14Fish, we've been working on an addition to our suite of tools called Library. But in light of the recent increased cases in scarlet fever, we thought it sensible to release this taster revision video on scarlet fever. We hope you find it useful.
Last year. So just a quick reminder about scarlet fever. Classic, it's a streptococcal sore throat, isn't it? So it starts off with a sore throat and fever, and then develops in some people a very specific rash. And once again, as we've said with some of the other infections we've been talking about, there is quite a spectrum from very mild to quite severe. And this is all to do with the streptococcus releasing a toxin, and it's how allergic the person is to the toxin that decides the sort of symptoms that they're going to get. And so the more allergic, the more likely they are to get the quite severe scarlet fever rash. And in fact, one of my patients just the week before last was sent away from casualty being told that their child was sunburnt, which was a bit bizarre considering the January that we've had. And actually when they came in, it was obvious that they'd had scarlet fever. So we'll look at the rash in some detail and talk about the varying range from mild to quite severe. Their tongue can become quite coated, and I don't think that's a particularly good sign. It looks like a white strawberry, but quite frankly, a lot of children, when they're unwell, tend to get that view of the tongue. And similarly, because it's an allergic reaction, you've got to remember that the rash, if it is quite a severe rash, they will often peel as if they've been sunburned, because they are getting cell damage, and that does result, as with sunburn, resulting in some of the skin peeling off. And other symptoms include headache, vomiting, being off their food, and generally unwell, which doesn't help. So this is a classic picture of the rash. And if you run your hand down, it feels like sandpaper. And so even in the people who aren't that allergic to the toxin released by the streptococcus, then although it doesn't get particularly red, you can still feel that very odd feeling, and that's pretty diagnostic. This is a picture of the facial rash, a classic sort of bright red cheeks, and often around the nose and mouth there is just white skin, so a perioral pallor. And how do you deal with them? Well, this is a nasty infection that can have potential complications, and we've spent the last 10 years banging on about not giving antibiotics to anybody with sore throats. Well, this is quite the opposite. We do need to give antibiotics, and they should have 10 days of penicillin or erythromycin. If there's no lab sensitivity. Although interesting, our local lab, when we did have a number of cases, suggested that we use amoxicillin in penicillin refusers, and certainly I would say 50% of our young children who we gave Pen V to wouldn't take it, so we ended up giving them amoxicillin. I'm not sure that the evidence supports that, and I think you would have to speak to your local lab, but it seems a pretty pragmatic approach to me. So they get 10 days of penicillin or erythromycin, and then they should have no school until 24 hours after the start of treatment. And it's important that this disease is notified. The figures that I've been giving all the way along are those of proven lab cases. So if you can imagine the number of cases that don't ever end up being proven in the lab, is probably 2, 3, 4, 5 times more than the figures that we're giving out. So what are we worried about with scarlet fever? Well, we're worried about the complications, and once again, complications due to infection, and in this case, complications due to autoimmune reactions. So the complications: ear infection, throat infection and abscess, sinus infections, pneumonia, meningitis and brain abscess, all due to local infection. And then the immunity issue is going on to have rheumatic fever, glomerulonephritis, kidney damage.